So welcome back to the channel. I'm Juan, and today we have a very special guest. She's an expert in ophthalmology who will be discussing the risk of LASIK surgery. So please stay tuned for some valuable information. So hello, Dr. Cynthia MacKay. MacKay, how are you today?
I am good. Thank you, Juan, so much for having me to discuss this incredibly important topic.
So can you tell us a little bit more about yourself?
Well, I practiced ophthalmology in New York City for 40 years. And during that time, I saw a lot of patients injured by LASIK. It was a dreadful experience. I also have the title of Clinical Professor of Ophthalmology, Columbia University College of Physicians and Surgeons, emeritus at the present time. I was there the day LASIK was born. I was in the Harkness Eye Institute at Columbia Presbyterian Medical Center when Dr. Steve Troquel came rushing into my room. He was a colleague of mine, and he handed me a piece of paper. And I couldn't believe my eyes when I saw the paper. It showed the cornea of a human eye, and cut into the cornea was a perfect rectangle. He said, "This is going to revolutionize ophthalmology. We're going to be able to shave the cornea and eliminate the need for distance glasses using this excimer laser." People get kind of confused about different lasers used in eye surgery. There are actually 5 of them. The excimer laser is the only one used to shave the cornea. I thought Steve had lost his mind. Any first-year eye resident knows that the cornea has the most nerve endings of any part of the entire body. And if you cut the cornea, you're going to have terrible pain. Imagine what it's like if you get a piece of grit in your eye. Now imagine that's all over not only one eye, but the other eye, and it never goes away and it can't be treated. The second thing I knew was that this would thin the cornea and weaken it, and all kinds of terrible problems would occur. And also, I knew that when the cornea healed, there'd be scar tissue and distortions. And I thought this would never catch on. I was wrong. I had underestimated the desire of people to get rid of their glasses. And I also hadn't thought that it would be possible that other ophthalmologists wouldn't speak out against this. And I'll tell you, I have tried many ophthalmologists, and they won't speak out about LASIK. So in LASIK, there are different layers in the cornea. There's a top layer called the epithelium, a bottom called the endothelium. In between is called the stroma. And you have to get into this center portion of the cornea to shave it off and change its focusing power. So you've got 2 ways to get rid of the epithelium down into the part of the cornea that needs to be shaved and reshaped. And there are 2 different ways. One is to scrape off the top epithelium of the cornea. And if you've ever had a corneal abrasion, you know what that's like. And that is actually the first type of laser that was approved by the FDA. It's called photorefractive keratectomy, or PRK, but it's easier to just call it LASIK without a flap. A little later on, they developed a technique, LASIK with a flap, where instead of scraping off this top layer, you flatten the eye down in a vise. You slice off a flap, you lay it aside, then the laser does its work and reshapes the cornea, and then you put the flap back on and you hope it heals. And that's flap LASIK. It's much more popular because you don't have all the horrible pain immediately that the PRK patients have. And that's usually what people mean when they talk about LASIK, is the flap LASIK. And all the problems that I realized would happen when you cut through the cornea have turned out to be true. And there are also a whole mess of problems I didn't even foresee. LASIK is a disaster. At least 30% of people get untreatable, permanent, disabling life complications from this. 30%. And 100% of people lose contrast sensitivity, the ability to distinguish between subtle shades of gray. Almost everybody gets some glare and halos around lights at night. Among an 8,000 member Facebook group that helps LASIK patients, there have been 40 suicides of people, because it's very depressing. It's very depressing to be completely disabled and to have horrible pain that you can't get rid of, and to not be able to see at night, to not be able to use a computer. And people take their own lives because they can't live with the pain. And this is cosmetic surgery. The only purpose is to get rid of distance glasses. It doesn't make you see better, just enables you to see without glasses. And for cosmetic, unnecessary, elective surgery to have that high a complication rate and to not warn the patients about that is malpractice.
That many LASIK surgeons on social media and advertising, like they claim that at the moment, modern LASIK technology is both safe and effective. They state that the side effects, like which you mentioned, like halos, starburst, glare, night vision issues, dry eye, looks like these are no longer a concern due to the advancements of the technology over the past 10 to 20 years, compared to the maybe older technology. So what is your opinion on these claims? I mean, are these side effects truly eliminated with the current technology?
No, and they never will be, because in order to change the focus of the cornea, you're going to have to cut away cornea. No matter what you do, whether it's PRK or regular flat LASIK, or whether it's SMILE, what kind of a laser they use, the person who's doing the laser doesn't make any difference, because you're still cutting through cornea tissue. You're cutting corneal nerves. They will not heal. There'll be chronic inflammation for lifelong. The cornea will heal with scar tissue. There'll be distortion. These are permanent, inevitable, untreatable complications. You can't avoid them. If you're going to reshape the cornea, you're going to cut the cornea. And if you cut the cornea, you're going to get all the problems that we've already discussed.
I've also I have also seen that um, some claims from LASIK surgeons that apparently there are no documented cases of blindness from LASIK. I mean, how accurate is this?
It's completely idiotic. There are many cases of blindness from LASIK. As a matter of fact, I have just co-authored a book, The Unsightly Truth of Laser Vision Correction. Um, I had three co-authors, and that has in the back of it 11 pages of citations, scientific articles that document every statement we make in this book. if the LASIK surgeons say that, they're either not reading their own literature, which is unacceptable, or they have been reading the literature and they're lying, which is worse.
What about all those patients that maybe had LASIK or BRK? I mean, any kind of laser vision correction surgery. What about all those patients that maybe had the surgery 5 years ago, 10 years ago, and they are saying, "Oh, I'm perfectly fine. I don't see any issues. I even recommend the surgery." I mean, could it be that those patients may uh, suffer all these adverse effects in the future? Is that possible?
Well, two things. First, these patients are very lucky. They haven't had the complications yet, but there are late complications to this surgery that can come on as late as 25 years after the person has the surgery. First of all, they get cataracts 15 years earlier. 15 years earlier. You have people in their 30s now and their 40s who have to get cataract surgery. There is a 60 times greater risk of retinal detachment. And there's a late complication that is devastating. It's called ectasia. And ectasia means that the cornea, instead of staying a nice, smooth, rounded shape, starts to bulge out like a hernia or a tire that's got a balloon in the tire. And there's no way to treat ectasia. You can try contact lenses. You can't do a corneal transplant because remember, I told you that these corneal nerves stay inflamed lifelong. The inflammation never goes away. So if you do a corneal transplant, it's going to fail. So for the people who already have had LASIK and they're happy, well, I wish them luck. They've got to keep seeing their eye doctors because the late complications can start coming on. We have in our book, when the complications do come along, a list of all the different doctors who treat LASIK complications in the United States so they can get going early if they develop a complication. Statistics show that after 7 years, 55% of patients wish they had never had LASIK. So there's a 55% dissatisfaction rate to LASIK. Also, most of these people are still wearing glasses. Consumers Reports did a study that showed after LASIK surgery, 70% of people were still wearing glasses, either distance glasses or near glasses or both. And also vision can fluctuate after LASIK surgery. It can go from being nearsighted, it can be farsighted, it can fluctuate in between. Some eyes fluctuate. Patients have 5 different glasses they're putting on and taking off because it's so, their eye is changing so much. It's a terrible situation. So for these patients, just tell them they need very frequent eye exams by a competent cornea specialist, and they'll be very lucky indeed if they don't develop some complications down the line.
Groups of patients that had LASIK, I have heard many saying, "So I'm happy with my result on the day, but at night it's so bad that even I cannot even drive at night." Like, why does this happen? I mean, can you explain why LASIK can affect like night vision?
Yes, well, it's inevitable because remember, you started out with a cornea that had a single perfect curve, like half a dome. Now you've taken a laser and you've flattened the central part and changed the focus So the focus is now on the retina. But look at the periphery of the cornea, the part over here that hasn't been changed. That's still got the old focus of the eye. So the eye now has two different focuses. It's got the focus from the center, which is going right on the retina, and it's got the focus from the periphery, which is focusing off the retina. So people will always have problems in the dark. In the light, your pupil constricts down, and then you're seeing through the central part of your cornea. When nighttime comes, your pupil dilates, and now the peripheral retina comes into play. So, inevitably, even if people can adjust to it, you will always have problems at night in dim light when your pupil dilates. And many LASIK patients go blind at night. They just cannot see at all. They have to give up driving. I knew a theater critic who had to stop her job because when she got in the theater and the lights went down, all of a sudden she couldn't see the actors on the stage. So, particularly if you have to function at night, this is a terrible operation to have.
There are some specialty contact lenses that can help with these horrible LASIK complications. These are called scleral lenses. What can you tell us about these lenses?
Well, specialty lenses are available from people who specialize in these lenses. And one of the people who was a co-author on this book is Dr. Edward Boschnick. He's an OD, not an MD. He's an optometrist. He's in Florida, and his specialty is making scleral lenses to help patients see better. Now, he can help them see somewhat better, and he may allow patients to be able to maybe read again or possibly even use the computer again. But he can't cure it, he can only manage it. And they're expensive, these lenses, and they're uncomfortable. And remember, people had this surgery to get rid of contact lenses. Now they're wearing very uncomfortable, difficult, expensive contact lenses so they can see.
Got it, got it. Yeah, so it seems that when you go from a simple, well, you can call it like simple myopia to now LASIK creates these complicated vision issues, and the only way to restore this vision might be with these specialty lenses, right?
Right? Yes. And it doesn't restore it completely, it just makes it better. It makes people able to function somewhat. But you can't cure these problems. I've been telling you all along, these are permanent, untreatable complications. We haven't even talked about pain yet.
Right, right. So, what can you tell us about this topic of pain after LASIK? I mean, I have heard that most LASIK advertisement they mention the possibility of dry eye, and that might last like maybe max 3 to 6 months at the maximum. Like, what can you tell us about this topic? I mean, is it dry eye or is it pain, or how does that work?
Well, it's usually pain, and it's a terrible kind of pain called neuropathic pain. Remember that LASIK cuts corneal nerves? And so these nerves are firing wildly. It's like the phantom pain that you get after, let's say, you've lost an arm has been cut off, and you still feel pain in one of your fingers. That's because the nerve here that used to come from your arm is still firing. And these corneal nerves are now saying, we're in pain, we're hurting, there's something's wrong. And the, the LASIK surgeons will call this dry eye. But it isn't dry eye in most cases. It's chronic neuropathic pain, which is very difficult to treat. You need a specialty clinic. You'll need very expensive eye drops made from your own serum, your own blood. You'll need pills, you'll need antidepressants, you'll need pain pills, you'll need all kinds of different things. You're putting drops in your eyes every hour. And these are eyes that were fine before they had LASIK. It's inconceivable to me that anybody would do this procedure. We have many stories from patients in this book. And in the book, there inevitably there's no knowledge or attempt to treat these problems. As a matter of fact, there's denial that the patient has the problem. They will claim that the patients are making it up. They will claim that the patients are crazy and send them to psychiatrists. And they won't refer them to the proper care centers. And in Europe, they've done some studies on how to treat chronic pain after LASIK. There aren't any studies done in the United States because the doctors don't want to admit that this problem exists. You have probably heard a statistics that the LASIK surgeons will say. They'll say there's a 1% complication rate. Do you know how they define a complication? They define a complication as not being able to see 2040, not 2020, but 2040 with glasses in their examining room. That's a complication. Pain, that's not a complication. Ectasia, not a complication. Horrible dry eye, not a complication. Inability to use a computer, not a complication. The only thing they will admit is a complication is if you can't see 2040 with glasses, looking at an eye chart where everything is in high contrast black lines on the screen. That's where that particular statistic comes from.
Are you aware of any other ophthalmologists or optometrists or eye surgeons who share your perspective that, I mean, LASIK might not be a good option for individuals?
Absolutely. I have two friends who did LASIK initially, but they don't do it anymore. One is a very famous corneal specialist who was among the very first doctors in the world to do LASIK. He doesn't do it anymore, but he won't speak out against it. Another friend of mine used to do LASIK. He's a very good surgeon. He actually operated on my right eye to remove a cataract. And what he said was, don't do LASIK anymore because if anything goes wrong, there's nothing you can do about it. In other words, he realizes these complications are untreatable and permanent, but he won't speak out. None of them will speak out. It's like an omerta. It's like a code of silence in the mafia. They won't speak out. I busted my butt trying to get other ophthalmologists to speak out against this. I talked to two of the most prominent doctors in the world who treat LASIK complications. They spend their days seeing LASIK complications. And I said to them, would you be willing to say for our book something simple, such as the patients don't understand the true rate of the complications? Absolutely not. They wouldn't say anything against them.
So let's talk about the consent form. I mean, there is supposed to be a consent form that patients read and sign like before getting the surgery, right? So, I mean, do you think patients I mean, are they not getting properly informed about this risk before undergoing the procedure?
You've put your finger on the single most important part of the LASIK problem. The consent forms deceive the patients. They don't give the percentages of the risk. For example, the risk of getting a dry eye, and this is from a paper that was published in 2024, is 75%. And it's permanent. The forms will say something like, there's a risk your eye might be dry temporarily. They don't say it's 75%, and they don't say it's permanent. And I operated on human eyes for 40 years. And I know it is the duty of every surgeon to explain the complications, the alternate therapies, the risks, and the benefits clearly to the patients. These doctors are not doing that. And I've had some of the patients in this book were given the consent form when their eyes were dilated, when it was half an hour before the surgery, and when they'd received a tranquilizer. That's illegal. Also, there's another thing. These LASIK surgeons try to get their patients to have both eyes done at the same time. That's something we never do in ophthalmology. We wait at least 2 weeks between doing one eye and then doing the other. The reason is that if there's a complication on the first eye, they will know that they shouldn't do the second eye or they'd use a different technique. These surgeons are operating on both eyes on the same day. That's unethical. You shouldn't be doing that. They know that if you operate on one eye, and even if they get a quote unquote good result, if the patient compares that eye to the other eye, they'll see there are distortions, there's a lack of clarity, there's there's glare and haze and dazzle and double vision at night, and they won't get the other eye done. So the whole consent form process during LASIK is a mess.
Has there ever has there even been a case where a patient truly needs LASIK, like meaning that they have no other option to restore their vision? I mean, does this even make any sense, like medically speaking?
Good question. Yes, there's a very good option if your eyes can't see at distance. It's to wear glasses. Glasses are not permanent. They don't have any complications. And you can take them off if they bother you or change the glasses. There is absolutely no reason why anybody should have LASIK when you can have glasses or you can have contact lenses to fix a distance vision problem. You shouldn't have surgery for a cosmetic, unnecessary reason.
So you mentioned cosmetic surgery. So I understand, like, I mean, you specifically oppose LASIK for all these reasons, but we understand that there might be other eye surgeries that obviously carry risk, but those might be necessary. Like, I mean, I guess that's the main difference between other procedures like glaucoma surgery or cataract surgery or retina disease. Like, those are like actual necessary reasons to have an eye surgery. Am I correct, or can you?
Well, I spent 40 years operating on eyes. I was taking eyes that were sick for some reason, that had, as you mentioned, glaucoma or a cataract or a retinal detachment, and I was making them healthy. LASIK takes healthy eyes and makes them sick. There's nothing wrong. There's nothing wrong with this eye of mine that doesn't see at distance. If I put my glasses on, I see perfectly, no problem. It doesn't have a disease. The eye surgeons will talk about throw away this crutch of your glasses. Glasses aren't a crutch, they're just a way to see distance.
If the LASIK clinics tend to downplay or ignore the potential side effects, like, I mean, where can the patients find reliable information about the risk and consequence of LASIK? I mean, will the FDA website be a good resource for this?
No, they talked about setting up some kind of a form that the surgeons had to give to their patients before surgery. They talked about that a couple of years ago. They haven't gone through with that. And they they won't help at all. But you can just go to Google and type in LASIK complication, and pages and pages and pages and pages will come up.
So it seems the FDA is aware of these issues, right? Like, uh, I mean, what is the actions that they are taking? Like, do they just continue everything as normal, or are they planning to, I don't know, make anything to for patients to be informed? Like, are they doing anything at all?
Now, this man, Dr. Morris Waxler, PhD, was head of the FDA committee that approved LASIK. After he saw the complications from LASIK, he met many patients whose lives had been ruined by the procedure. He went back to the original statistics, the original studies that the LASIK surgeons gave him when they wanted approval. And he discovered that there were all kinds of complications that they said were going to be temporary, but they lasted for at least a year. And so he has testified before the FDA twice. I went down with him 2011 and 2018. And a woman who's a LASIK damaged patient herself, Paula Kofer, who's an extraordinarily brave and resourceful woman, despite terrible pain and blindness, she's fought to tell the truth. And we testified, and LASIK damaged patients spoke, and we gave the FDA reams of information. I gave them a consent form that was accurate and listed the actual complications, and they're doing nothing. Well, you have to understand that until a couple of months ago, the head of the FDA was married to a woman who was a lawyer. And his name was Shuren, Shuren. And she was a lawyer at a prominent Washington law firm. And if somebody wanted to get a procedure or a drug or a surgical instrument approved, they would go to this Washington law firm, and they would go to Shuren, Mrs. Shuren, and they would pay her a lot of money, and miraculously, their surgical instrument or their procedure would be, or their drug would be approved. That's called corruption. And the, the present woman who's been appointed to the FDA is deeply involved in LASIK herself. She does LASIK on the weekends. So we can't ask the FDA to help us. We've got to rely on advocacy such as you are doing, Juan.
So Dr. MacKay, I mean, do you gain anything from your activism raising awareness about the risk and consequences of LASIK?
Zero. Why would I get anything? People just get angry at me. Every cent of the proceeds from this book, every single cent, is going to help damaged LASIK patients. I contribute every year to the organization that receives this. All I get is the waste of a lot of time and the condemnation of my peers. It's not a profitable business, let me tell you. My compensation has been zero.
Um, I mean, I think it's been, I guess, more than 25 years since LASIK was introduced. I mean, at least in the USA, I believe. So, I mean, with the rise of like social media, the internet, like articles highlighting the risk. I have also seen many important news outlets like the New York Times talking about LASIK complications. I mean, has the volume of LASIK surgeries decreased, or is it even more popular? Like, what do you think about the numbers?
The number of LASIK surgeries today is half, or the number of LASIK surgeries in 2024 was half that of a couple of years ago. And in Japan, the number of LASIK surgeries has dropped to negligible amounts. So we are making some headway, despite the fact that the regulatory agencies that should be protecting the public are not doing their work. So I believe that 10 years from now, nobody will be doing LASIK. Oh, but since it's decreased by 50%, let's hope next year it decreases by another 50%, and pretty soon it'll be zero. You have to realize that 40 million people around the world have had LASIK. 20 million of those people are in the United States. And 30% of those 40 million people are going to have permanent, disastrous, life altering, untreatable complications. So that's 12 million people. That's a lot of people. And the word is getting out. And you're doing the world a great favor with your courageous advocacy. I applaud you.
Thank you so much, Dr. MacKay, for your words. I mean, we have talked about this book that you co-authored with Maurice Waxler, who is I mean, the former FDA chief who approved LASIK, Edward Boschnik, who is an optometrist who helps um, post-LASIK damaged patient, and Paula Koffer, who he's an advocate. I mean, and a patient herself, right? So, where can people get this book?
It's available everywhere. Just go on Amazon. Type in the unsightly truth of laser vision correction surgery, and up it will come. And you can order it, and it will be sent to your home.
What I will do, I will share the link in the description of this video, so anyone who watches us, they know where to get it. Got it. So, okay, so um, let's talk about the film. There is one film, a recent film about this topic of LASIK complications. The film is called Broken Eyes. So I'm just gonna share my screen.
The poster for Broken Eyes.
Yes. So
This
what can you
was
tell us? Mhm.
this was for the world premiere, which was in Minneapolis in April. Sunday, April 14th was when it was first shown to the world. This film was written and directed by Dana Conroy, who's a PBS documentary producer, and I was the executive producer of the film. And it shows from the patient's point of view what it's like to live after your eyes have been destroyed by LASIK. It's very moving and very effective. And it is going now to a different series of different film festivals all over the world. And it's won many awards. It won in the Soho Film Festival in New York City. It won the prize for Best Documentary, and it also won a prize for the best female director. And it won the prize in the Dubai Film Festival for the best documentary. And it's got a couple of more film festivals to go. And then it will probably get released on PBS so the public can start to see it.
So what I understand, Dana Conroy, she's a LASIK patient herself, right?
Yes, she's a LASIK damaged patient. She lives in constant pain. Her eyes burn constantly. She's putting in these special drops made from her own blood all the time, and she can't see. She's had to completely change the way she films because she can't see the faces of her subjects. She listens instead of watching them. She has such courage and grit, and I can't tell you how much I admire her. And I appear in the film maybe a dozen times, just introducing various subjects and commenting on the procedure itself from a surgeon's point of view. So it's well worth watching. Very good film.
I'm gonna share the screen. I was able to get some uh, pictures. Let me.
Well, I recognize all those pictures.
Yes. So I believe this was the premiere of the film. Am I correct?
The Minneapolis St. Paul International Film Festival last April. I'm on the left. Immediately to my left is Edward Boschnick, the optometrist who treats LASIK damaged patients. This next to him is Paula Kofer in a black dress. She's the LASIK damaged patient who became an advocate. The man in the back with the gray hair looking to one side is Morris Waxler. The beautiful blonde lady in the front is Dana Conroy. She is the director of the film and a LASIK damaged patient herself. And all the other people in the photograph, the other 5 people in the photograph, are LASIK damaged patients who are trying to live their lives and get through.
So what can you tell us about this picture? I mean, what happened on this day?
Well, that picture was taken in 2018. It's, as you can see, before the Food and Drug Administration in Washington, D.C. I'm on the left in a bright blue jacket. Immediately next to me is Paula Kofer, the LASIK damaged patient who's become a LASIK advocate. Next to her is Morris Wexler. And next to him, in the red and blue, is a doctor whose son committed suicide after he had LASIK. That's Nancy Burleson. And she's become a LASIK advocate herself because of the suicide of her son. And that's where we begged them to make some statements. I handed them my consent form with the proper percentages in it. And Paula spoke, and Mara spoke, and Nancy spoke, and they got reams and reams of material. And there were 2 other LASIK damaged patients that spoke that day, and they have done zero, nothing, silence. They were talking about requiring a consent form that mentioned the risks. But so far that hasn't happened, and I don't believe it will happen. But I'm ready to be happily surprised.
Okay, got it, got it. So it seems like all these meetings, all this fight with for advocacy, um, it was the beginning of this FDA draft that I have heard that it's potentially they will give it to patients, right?
Well, I hope so. I'm not holding my breath. Morris and I first testified before the FDA in 2011, and he talked about why he had changed his mind about LASIK and how misleading the statistics were. And I talked about how the cornea heals and what happens inevitably after you cut into the cornea. And we testified for quite some time before the FDA panel, and nothing. So twice, and a strikeout both times.
Okay. So, okay, well, thank you so much, Dr. MacKay, then for joining us today and sharing your incredible insights. So it's been a pleasure having you on the channel. So I'm sure our viewers really appreciate the knowledge that you have shared. So we love to have you back sometime in the future, hopefully with some better news from the FDA. And so, any last message that you want to share with the audience?
Well, I just want to thank you, Juan, for helping to spread the world about this disastrous procedure. You are helping to prevent blindness and death and doing the work that should be done by the agencies that are supposed to protect the patients, such as the FDA. So I will come back whenever you want me to come back with pleasure and gratitude.
Great, thank you so much, Dr. McKay. Okay, so yeah, well, thank you everyone for watching us. So yeah, Dr. McKay. So well, take care and so best of luck and see you soon.
Thank you, Juan. See you
Thank you.
soon.